first of all, having the VA up here is tremendously important, but we cannot do it without community partnerships. And that is uh, because we're small, we don't have all the services as a big city hospital or medical center would have. So we do depend on that. And we have our VA community care program for that. So that is where, if we cannot provide the service or if the veteran has to travel, in this case, our standards are more than 30 minutes for primary care, 60 minutes for specialty care, then we can refer them to a community partner. Now, these are medical facilities, healthcare partners that have enrolled in our community care network, VA, and that's through Optum, which is a third party administrator. But we can refer them to these other providers, for example, in Marquette, in some of these other areas, that they don't have to. And I'll give an example, physical therapy. We don't have physical therapy at the Marquette VA clinic. And for someone to drive, an hour and a half down to Iron Mountain. We have a great physical therapy service here. But as one veteran says, by the time he drives 85 miles each way, the therapy was all for naught because it's not the easiest road, and and sitting in a car. So then what we do is we refer them to a local physical therapist that's in our community care network. So they're not VA, but when they serve our veterans, the VA pays them, and we consider that VA care. So that's how we do it. And to kind of give you an idea, we serve 20,000, approximately 20,000 veterans each year are in our patient service area. We have actually more that are enrolled, but not everybody uses our services. They have private insurance, which they can do. They can pick and choose. They can use us for some services, and they can use our private insurance for others, or Medicare. But what they would do then is that we would then give them that referral. And I was going to say, out of that 20,000, 12,400 of these veterans use some form of community care in 2020. So that's the majority of them in some form or another. For example, my son's a veteran, gets his care here. He gets his primary care here, but he went into the community for a specialty care appointment. So many of our veterans do use community providers at VA expense because we don't necessarily provide the care here. We do provide the care like down in Milwaukee, and some veterans don't mind doing that because, again, VA does provide very good care as well.